है और 85 kg वेट है इसका. So, what did we understand? It's a beautiful subject, beautiful recovery, and most important is you must love this subject. The more you love, it's like your wife. It's just like a share market. It has its own beauty. कभी गुस्सा, कभी ठंडा, कभी नरम, कभी गरम. So your wife and stroke is same thing. If you want to understand stroke, you should ask Sunil. Sunil is the best person to tell you what is a wife. In class, Sunil is very cool, but when he talks to his wife, he is very hot. So that wow factor should be in you and you should be able to recover stroke. In coming 1 hour, we'll speak about lot of things about stroke and then you will be understand. At the end of the key objectives, you'll understand what's the beauty of what? Brain stroke. So similar things will repeatedly we speak in many parts, right? And when we speak similarly, the things you'll understand a lot of factors in the part, right? And I always request you, please put the messages in the group, link and message, the class has started. MK Shastry, class has started, right? So, page. Yeah. So here you can see a beautiful area. The arteries, what you see is from the circle of Halley's. So these are the vertebral arteries and then the supported by the basilar artery. And from here you will see the whole circulation of the brain is gone. The moment the circulation is ruptured, the nutrition is absent, you suffer from paralysis. Now the anatomical area which has damaged, the tissues which have damaged speaks of the paralysis. So now if you have a capsuloganglion hemorrhage, you see a paralysis here. What do you see paralysis? One hand and one leg not working. But why it is not working? That is the main area involved. So what has to be identified? The artery involved, the anatomical area involved, and the pathway to be seen in the recovery of the patient. Clear? So this is a beautiful picture which God has made. It is divided into sulcus and gyri. So whatever the lines you see is sulcus and whatever the absorbed area you see is gyri. So that is the part which you have to understand. So the most leading cause if you see is death is what? Stroke. And the leading cause of serious long-term disability is stroke, brain stroke. Once you are disabled, I have seen people being disabled. You have become disabled at the age of 25 years. Now you have reached 50 years. You are disabled. कल तक अच्छे थे, आज हाथ पांव करना बंद कर दिया. And you see the mystery of the society. We don't have the solution to this problem. We have a lot of things to speak about the stroke, but we don't know how to resolve it. We are speaking about this wind stroke and all. I tell you, everything is okay. But what is the solution of the problem? That has to be focused. So to know the solution of the problem, the first thing is we must know what is the question. So what is the question here? What is a stroke? And what is the importance of stroke in the society? So we call it epidemiology. So you will see the leading cause of serious long-term disability. And the third cause of death is stroke. It is epidemic of the society. So in Indonesia, I've been in Indonesia for a long time. In Rishikesh, Dash and Debke's study in 2007, the stroke patient is what? 8 by 83 per 1000. Mortality rate 15 by 14, 15.4%, 6.8%. Ischemic heart disease 5.1. So what do you understand? Stroke is 15% and 4% is hypertensive. So stroke, we'll understand this thing in such a way that we have a stroke because of hypertension. And each hour, now I've spoken you so many things now. By now already 30 people have undergone stroke in any part of India. In just 10 minutes, we have seen 50% stroke patients. And these stroke patients are permanently disabled. And the most difficult part when we speak is this disability is forever. Making him walk is not a issue, but bringing his life to a back to his own resort is a issue, right? So stock statistics in US 2010 is 143579. People die each year from stroke. So such a big data is there. 1,43,579. It is in 2010. The new data I don't have. Maybe now you can double it or triple it. Each year about 7,95,000 people suffer from stroke. Such a big subject. About 6 lakhs of these are first attacks and 1,85,000 are from recurrent strokes. So first thing we must understand in stroke, the recurrency of the stroke is very high. Out of every 5 patients, 2 patients have recurrency of stroke. Am I speaking very fast or you are able to understand what I am speaking?
No, sir, we
My
can
speed is
understand.
okay?
No,
Yes.
sir. We are getting.
Or am I speaking too fast?
No, sir.
No, sir. No, no.
Should I slow my speed of speaking
No, sir.
or is it okay for you?
It's okay, sir.
It's okay, sir. It's okay.
Yeah, right. So from this we can understand 3 points. Stroke is a very big problem. It is a piled up problem. Year after year, stroke is coming. Year after year, people are becoming paralyzed. And year after year, there is no solution to paralysis. By the moment I complete this talk, maybe 1,000 people in India have undergone stroke. So you can understand every minute we are having one stroke patient. So if you want to understand this, you go to a ICU, you will understand. Every minute you will see one stroke patient there. You are sitting at home, so you don't know. The moment you go, you will see every minute you have a stroke patient. A major economic burden on the healthcare system. You see, this is the biggest problem. So whenever a person suffers from stroke, this is the biggest economic burden on the government, insurance company, and society and family. Because ICU charges, the disability of the patient, and he becomes non-functional. I still remember a IS officer, senior person, got stroke. Even you might have heard a name, was C. Rangarajan, former governor of our Reserve Bank of India. Up to now, his fingers are like this, tiger claw. When I visited him last time, I was able to mobilize his hand, but then it's too late for him to do anything. So you can see how a big people and everyone get influenced by stroke. So you must be very careful when you speak about stroke. And don't become so serious that you may have a stroke in the class. भाई इतना सीरियसली भी मत सुनना कि तुम लोगों को ब्रेन स्ट्रोक हो जाए. Understand, Praveen? Don't make a brain stroke in the class, okay? Dharam, don't have a brain stroke in the class. After the class, you may have a brain stroke. Don't have it in the class, okay? Otherwise, my student will run away. Hmm. So now we have classified into two major categories. What are they? Ischemic stroke and hemorrhagic stroke. Right? The ischemic means the dislodge. It is called embolic. And what is the other one? Emboli means what? The clothes. When arteries are blocked by when the plaques are built up, the cholesterols are built up in the arteries, especially in the carotid artery and anywhere, they are dislodged. And approximately 80% of the strokes are ischemic. That is, the clot has been dislodged and it goes inside the artery of the brain. The moment it goes inside the artery of the brain, you will see that the entire blood circulation is affected. The moment the entire brain circulation is affected, what you will see? The damage inside the brain. The moment you see the damage inside the brain, you see the deficit inside the body. What do you mean by deficit? He is not able to perform as he was performing earlier. So that is called what? Deficit. There are two types of deficit, neural and sensory. Am I right? अरे एक आदमी माइक खोल के रखा करो जो उसके पास बैकग्राउंड में आवाज नहीं है.
Yes, sir.
Otherwise, I will sleep in the class.
सर स्लाइड चेंज नहीं हुआ स्ट्रोक के बाद वाला.
हेमरेजिक स्ट्रोक में कहाँ है हम लोग तो. So,
Ischemic stroke ಕೂಡ ಇದೆ.
so ischemic stroke is embolic and other is what? Hemorrhagic stroke. It is what? Intracerebral hemorrhage, subarachnoid hemorrhage, and ICH. So SAH is generally because of aneurysm, and the deep inside the brain, when the artery ruptures inside the brain, is called what? ICH, intracerebral hemorrhage. So we'll see about this ischemic stroke and this. So one thing you can understand, when the blood is involved, it is hemorrhagic. When the clot is involved, it is ischemic. 80% of the cases are ischemic and 20% are hemorrhagic. Am I clear in this slide? 2 points to be noted. Stroke, ischemic, hemorrhagic. Ischemic, clot formation, no blood involved. Hemorrhagic, bleed involved. That's it. 2 line. Ischemic, hemorrhagic. Ischemic, clot, non-ischemic, bleed. You understood?
Yes, sir.
Yes. So you will see pathology and anatomy of ischemic stroke. So there is cerebral thrombosis, cerebral embolism. So we'll again speak about this. What is, I told you that there is thrombosis and embolism. So thrombosis is what? When it is transferred from the heart or anything. So again we'll speak about thrombosis and embolism. I have already solved when the clot is dislodged. So again we'll speak about those things. Hemorrhagic stroke, it is ICH and subarachnoid bleeding. I told you intracerebral hemorrhage and subarachnoid bleeding, clinical journey. So whenever you see about clinical journey, the first thing you must understand is TIA. TIA is such a stroke, it does not create much problem. It is only for 24 hours. There is no rupture and no disruption of blood supply, but it is a warning signal, sir, you are going to have a stroke. So whenever TIA says, remember it is called good morning, sir. What is the meaning of TIA? It is called good morning, sir. What do you mean by good morning, sir? Sir, I am coming to your home. So be careful, sir. I am coming to your home. So when I come to your home, you will be paralyzed. So TIA means what? Warning signal of stroke. And so whenever we speak about various things, whether ischemic stroke is reversible or not. See, I have treated with more than 256 types of brain deficits. How many? 256 types. And each stroke has its own beauty to speak. It's a beautiful girl. When you see a beautiful girl, Sunil, may I ask you one question? When you see a
Yes, sir.
beautiful girl, what will you like to do? धर्म एक सुंदर सा लड़की देखने के बाद तुम्हारा सबसे पहला मन क्या करेगा? हाँ?
Sir,
एक सुंदर सा लड़की देखने के बाद तुम्हारा सबसे पहला मन क्या करेगा? French kiss. This French kiss is called action potential of neurons. So neurons also do kiss, and they have a music inside. It's a very beautiful music when you speak about this. So when you understand the music of the neurons, when you understand the kiss of the neuron, Sunil is very experienced. Sunil has two children. So Sunil can explain in detail in next lecture how is French kiss given and how you can give birth to two babies. So Sunil will teach you. Next lecture will be taken by Sunil. In 15 minutes, he will explain you everything. Another one,
Yes, sir.
Sunil can explain beautifully what is French kiss and how children can be born. So in this, the children which are born is neurotransmitters. So whenever you give a French kiss, the sodium
अच्छे
channel
से बोले।
opens up. The sodium channel and calcium channels, when they open up, they release neurotransmitters, and this is called chemical changes. Whenever there is a disruption in this communication, you suffer from deficit, and this deficit is called neural or sensory deficit. Am I clear? There are two types of
Yes,
deficit.
sir.
What are they? Neural and sensory. So whenever the
senses.
patient is speaking, I have numbness, please prick one needle, touch the cotton, touch the finger. And when he says all the tests are negative and he is able to feel everything, what you should say? You are not suffering from stroke. You are not suffering from not stroke, sensory deficit. Because you are wearing the pants for the whole day, right? So now the skin has been comfortable with your trousers. So at the end of the day, these people will come and they say, I'm having numbness. So Naman can make very good money. Oh, you are feeling numbness. Don't explain them because you are 24 hours wearing trousers. So you are feeling numbness. You should say, oh, you are feeling numbness. You have a sensory deficit. Your sensory nerve has gone down. Now we have to give you treatment. And treatment is of 25,000 rupees. So without disease, you give him a treatment, and that treatment is cost 25,000 rupees. Otherwise, sensory deficit can be identified by nerve conduction velocity test. So what is inside, you can identify. So never try to misguide a person. Why? Because if you say there is a sensory deficit and what patient is saying is not correct, right? Patient may say, I am having this. Patient even may say, I am the president of America. What will you do? You will give him Z plus security? No. You must understand. He is having some problem. The problem is, now for example, I am wearing this shirt, right? So if I wear this shirt for 24 hours, what will happen? I'll feel that this skin is accommodated with this sensation. Since this skin is accommodated with this sensation, I want feel the sensation of the skin. What will happen? I won't feel the sensation of the shirt. And generally, this is what they call as numbness. So there is nothing of such numbness. It is only two deficits we have, neural and
Sensory.
sensory.
Yes.
Clear?
Yes.
Yes, sir.
So whenever you speak about cerebral circulation, how do you speak? It is only two type of circulation. What are they? Posterior and
Anterior.
yes, posterior in the frontal area and anterior means in the backside,
Okay. Yes.
right? Am I clear?
Yes, sir.
Yes, sir.
So now you can see a very beautiful image of the stroke. Here you can see the clot has been stopped in this area. Now, since the clot has been stopped in this area, the grayish area you will see there is no blood, but the tissues have been dead because the clot, if you see, you can see my cursor.
Yes, sir.
Yes, sir.
You can see the cursor.
Yes, sir.
Yes,
Yes,
sir.
sir. Yes, sir.
So
Yes,
you
sir.
see this cursor. When you see this cursor, the blood circulation is absent here, right? Since the blood
Right.
Yes.
circulation is absent, all the neurons of this area are dead.
Then
So if these are dead, what will happen?
the neural communications were destroyed.
Huh?
Blood flow
If
won't be
this,
there in that section, sir, because of the
madam,
clot.
you speak slowly and little loudly. Because by now I picked up 1,000 phone calls. I'm not very much comfortable with hearing all your voices. So whenever you speak, you have to speak slowly and little loudly. Okay? Please tell me. Hello?
Sir,
Please tell me.
clots have stopped the blood supply on that area.
Yes. The blood supply of that area is stopped because of the clot. Something has stopped it. Clear?
Right.
I'll give a very beautiful video of this class also. So you can understand more beautifully. So when something is stopped, what will happen? The grayish area means what? The death of the neurons. So when these neurons die, what will happen? There is a deficit. It is called what? Paralysis. Now, it can be various. Now, if you see MCA infarct, paralysis, CG, on-time infarct, paralysis, CG bleed, paralysis, MCA 1, 2, 3, paralysis, FCA infarct, paralysis, ventral infarct, paralysis, right? So every time what you see is paralysis. But what is the reason of paralysis? You don't know. You try to treat the paralysis, but you don't try to treat the brain. And this is the biggest problem we are facing in the world. The problem is in the software, and we are treating the hardware. For example, my Microsoft is not working, and I'm trying to change my RAM. I'm trying to change my hard disk. Will it work? No.
No,
So
sir.
So the recapturing of the area, you have to re-encounter. For example, the enemies have encountered that area. The area has gone out of your, and this area has been encroached by the enemies. So to recapture that area, to redefine that area, you must understand a term called neuroplasticity. So when there is a neuroplasticity, you overcome this problem, and the moment you overcome this problem, the paralysis is recovered. So you must understand the neural basis of paralysis. So what is the term you have learned from here? The neural basis of paralysis. You should not say the word paralysis. You should say neural basis of paralysis. What are the things involved? Where are they involved? What is the artery involved? Who is sacrificed? Here you see MCA is sacrificed, middle cerebral artery is sacrificed. So this entire renal anatomy is sacrificed. So when this is sacrificed, you lose the neurons. The moment you lose the neurons, you lose everything. The moment you lose everything, you are good for nothing. So that is why I say, if you want to grow in your life, try to bring good people, try to bring associate, to try to improve your group. So that the more the bigger the group is, the more the bigger the association is, you get more chance to learn, interchange, exchange. And this is what the brain says. You have to exchange what you had. The outgoing neuron will say, I'm changing my information. The moment you change the information, you recover it. So this is what you have to understand. Here you see is a hemorrhagic bleed, right? So the blood artery is ruptured. But this happens in 20%, this happens in 80%. So in both the cases, you are capable to recover, provided you know how to work inside the brain. You have to speak. For example, if I keep silent, will you understand anything?
No, sir.
हाँ, मैं अगर यहाँ चुप बैठ जाऊं कुछ समझोगे?
नहीं सर।
तो तुमने ब्रेन को चुप बिठा के क्यों रखा है? पैराडाइसिस ठीक कराना चाहते हो, ब्रेन को चुप बिठा के रखा है, कैसे ठीक होगा? तुम ब्रेन को बोलते हो कीप पुट योर फिंगर्स ऑन योर लिप्स लाइक दिस। नमन हमेशा बोलता है पुट योर फिंगर्स ऑन योर लिप्स, ब्रेन को बोलता है चुप। अब ब्रेन को तुम चुप करा दिया तो ब्रेन साला कहाँ से क्या करेगा? अरे ब्रेन को बोलने दो, लेट द कम्युनिकेशन गो अमंग द ब्रेन, लेट ईच न्यूरॉन प्ले इट्स म्यूजिक, लेट न्यू कम्युनिकेशन एस्टैब्लिश। All students have gone. I had more than 5,000, 15,000 old students who have gone. Now new student has come. But this new students will not learn. Do you think? They will learn. And this learning of the new student and becoming capable is called what? Neuroplasticity. So outgoing of the old student and coming of the new student and training them and bringing them up is called what?
Neuroplasticity.
Yeah.
Neuroplasticity.
So every college is having neuroplasticity. Final batch goes, first batch comes, and they transform into final batch and they become what? Neuroplasticity. So everyone you are sitting here is having neuroplasticity. After the class, you have one level up because you have neuroplasticity. Every moment when you learn, you have a neuroplasticity. You have information. When you take all this information, you wind up with lot of things, and this image, this information helps you to recover patient. The more you recover, the more better you become. The more better you become, the more ultimately the purpose of your life is to recover the patient. The purpose of your life is to serve your family, and everything is done if your pathway is proper.
क्लास रीशेड्यूल
Here
करनी
you
है
can
तो
see. हाँ बोलिए।
क्लास रीशेड्यूल कर दूं ना, अगली 9 बजे खत्म
हाँ
हो जाएगी। क्लास 9 बजे खत्म हो जाएगी, रीशेड्यूल कर दूं ना इसी को?
ये आधे घंटे की क्लास लगा करा मेरी।
नहीं सर, 1 घंटे की थी, 1 ही घंटे की करवाई थी, उसको रीशेड्यूल कर देता हूँ।
हाँ करो, तुमको
ठीक
मालूम
है।
है मेरा 1 घंटा 2 घंटा 2.5 घंटा होता है। कहाँ से मैं चक्कर में फंस गया? 1 घंटा बोल के तो मुर्गा लाता है, मुर्गा लोग आया तो 2.5 घंटा तो पकाए। कहाँ से तुम मैं चक्कर में फंस गया? तुम्हें मालूम है शास्त्री जी का क्लास 1 घंटा का क्लास है तो 8 घंटा भी हो सकता है। तो कोई उसमें इंटरेस्टिंग टॉपिक आ गया तो सुबह का 5 भी बच सकता है।
जी सर, कंटिन्यू।
So understand, M.K. Sastry class can start at 8 o'clock, and if there is an interesting topic, it will go up to 5 o'clock. और कोई हो नहीं हो, सुनील को तो सोने नहीं देगा। एक
सोएंगे नहीं
मुर्गा
सर।
काफी है, एक मुर्गा काफी है क्लास का। सुनील नमन को सोने नहीं देगा। बस 2 मिल गया, सुबह 5 बजाना क्लास का। तुम लोग पढ़ो नहीं पढ़ो, हम तो पढ़ा दिया। So
आप पढ़ाओगे
here
तो
you
पढ़ेंगे
see,
सर।
now you see the beauty of the brain. Here you see the ischemic stroke. So what you see in the first picture, this is, I have Baba. Why are you going here and there? Thank you. So what you see? Now I have a neuroplasticity of this cursor. You taught me now, page up and page down. Now I have learned it. Now my brain is tuned. Now I can say to bring the one side up, one side down, my finger says this. So what is this called? Neuroplasticity. Means in tomorrow you don't have to tell me. One page up, one page down. So every day when I learn new things, I'll at the end of the month, I'll become the master of Zoom. So you'll have complete neuroplasticity. That is why I say you have to learn part by part, nerve by nerve, area by area. And here you see this is a beautiful circle of Willis, and you see whenever there is a clot in different areas, you see if the clot is here. Where is my cursor? Cursor कहाँ? Oh, ये रहा. हम भी कहाँ घुमा रहा है इसको. Here you see, if the clot is here, you lose monoplegia. If the clot is here, क्या लिखा है ये? What is written here भाई पढ़ के बताओ तो. What is this?
Disturbance in reading ability and sight.
So you lose, but what is written?
Disturbance in reading ability and
Ability, yes.
sight.
So it is, again you have the disturbance of reading ability means to acquire the memory. So what do you lose? So when there is a ischemic stroke here in this area, you lose your ability of retention of memory. So this retention of memory is again a problem, right? So this is also called what? Deficit. So now when you have a stroke over here, this area, right? This area, which near the honculus, it is called what? Hemiplegia. So when you have stroke over here, you have weakness in the other areas. So now you, in a small thing, you can understand 4 different strokes in 4 different areas give 4 different impacts. So in different way, 256 deficits I have recognized. How many?
256.
256.
Yes. This circle of Willis, this is this. Here you can see the stroke over here. This is the hemorrhagic stroke. In MRI, you will see it a white figure as hemorrhagic stroke, right? And in ischemic stroke, you will see a black structure like this. Difference between hemorrhagic and black in the MRI is white and black. So how will you remember? Black and white. Black means ischemic, white means hemorrhagic. So ischemic stroke, yes. I've already told you that you have an ability in reading and writing. You cannot understand things. Your power of retention of memory is lost. So here you can see it's called the circle of Willis. It starts vertebral artery, goes to basilar artery, and from there it distributes inside the brain. Right?
Yes, sir.
So here you see. So here you see this posterior cerebral artery. So you'll have with what? Difficulty in swallowing. Right? Dysphagia. What you will have? Dysphagia. So when you have here, you will find difficulty in speaking and working. And other part, if you see, already I told, you lose your weakness. So it is a very beautiful subject that people have sight, they have strength, but once you have a stroke, you lose everything. You lose your capacity to speak, you lose your capacity to walk, And tomorrow you will see I'll be able to remove one patient's rice tube and I'll try to make him eat food from the mouth and drink water. From tomorrow we will start that procedure and I'll see that the patient responds in a better way. So here you can see the ischemic stroke. Here you see the clot. Here you can see the circle of Willis, right? Different arterial circulation. So now you see the clot is dislodged here and the place which is disturbed is this area. The moment this area is clotted, you'll have a deficit. So one deficit is creating another deficit because overuse of muscles, inactivity of muscles, depression, oxidative stress, number of factors are contributed. So with stroke, we understand the chance, if the statistics is there, you may lose a life in only next 5 years. 70% of the people die in next 5 years of the stroke. There was a study established. Why? Because of stress, because of this. Even if you see in our WhatsApp group, there's Mr. Steven, and this person is suffering from stroke and is struggling from last 3 years to come up. And the process has become so slow that it took 3 years. But if you go with the right process, you can make it 2 months process, 3 months process. The process has to be identified. What is the problem and what is the solution? So already I told you, clinical science and system, diagnostic support, neuropharmacology interventions. So we will see what are the approaches. This is the pathophysiology of the disease. So here you will see anterior cerebral artery, the middle cerebral artery, akka, bakka, mikka, and this is the vertebral artery. This is the vertebral artery. This is the common carotid artery. So this is the common carotid artery. Then it is divided into middle cerebral artery, anterior cerebral artery, and posterior cerebral artery. So this is the main pathophysiology. Maximum cases you will see MCA infarct. So the ischemia pneumora, you can see this is the thrombosis. A beautiful picture of the thrombosis. You can see how it is clotting the brain and how the infarct is coming. The thrombosis blocked that area and it has come from somewhere. बिन बुलाए मेहमान ये सुनील कहाँ गया सुनील तुम्हारा साला आ गया
यही है सर सुनील
हाँ
भाई
सर
ये देखो आ गया साला तुम्हारा थ्रोम्बोस सारा घर को बर्बाद कर दिया तुम्हारा साला आके और कौन है सुनील का साला ये थ्रोम्बोस आन न मान मैं तेरा मेहमान आया कहीं से घुसा कहीं और बर्बाद किया कहीं देखो सुनील भाग भी गया धर्मा तुम्हारा शादी हो गया
Yes, sir.
चलो तुम्हारा साला बना देता सुनील डर गया इसलिए तुम्हारा साला बना देता देखो तुम्हारा साला को देखो क्या किया ब्रेन बर्बाद कर दिया साला
Yes, sir.
अच्छा भला हम चलता फिरता आदमी था कहाँ से तुम अपना साला को उठा के ले आया और हमको बर्बाद कर दिया इसलिए बोलता है साला थोड़ा हरामी होता है in a light mood, okay? Not all your salas. Don't tell your wife. Otherwise, they will beat you.
Okay, sir.
So you can see so many types of strokes are there. And you people think there is only one type of stroke. You see, so many images are there of the stroke. And you see only one image of the stroke. You read all the MRIs, you see all the pictures, but you don't know what to do. And this is the biggest problem of your what? Understanding a stroke. हाँ वाटी साहब हुकुम करिए. वाटी साहब कहाँ गए? अभी तो हाथ उठाए थे. वाटी साहब
मैं यही हूँ सर।
बोलिए, आपने हाथ उठाया, कुछ तो प्रवचन दीजिए.
नहीं नहीं, बहुत अच्छा आप क्लास ले रहे हैं, बहुत अच्छा स्ट्रोक का क्लासिफिकेशन है, वेरी गुड। आवाज आ रही है
आपका
आपको?
साला नहीं दिखाई दिया इसमें.
हैं?
आपके साले साहब नहीं दिखाई दिए.
हाँ हाँ, नहीं नहीं, साले साहब तो कहीं गए हैं, तो मैं ही अकेले ही हूँ।
नहीं, मैं सोचा स्ट्रोक में गए आपके साले साहब भी मिल जाए. सुनील का
अच्छा अच्छा।
साला आ गया, धर्मू का साला आ गया, आपका बाकी रह गया.
अरे बाप रे।
Please correct me if I am wrong anywhere, huh? What
नहीं
is
नहीं
that?
नहीं नहीं, सर सर
My
गुड।
health is not very good, but still I
नहीं
want
नहीं,
to take the class.
या
So if I am wrong anywhere, please correct me, huh?
सर।
So here you can see Numbera and you can see ischemic stroke and the ischemic Numbera. So more likely you can understand. You see how beautiful arteries are there. You see how God has created such a beautiful arteries inside the brain. And because of your food, because of the street food, because of palm oil and this Naman's food, Naman eating his food also and giving me his food also. Lastly, I had acidity. And
इसको
because
पागल
of this
कर।
acidity, I'm suffering. This is just because of Naman. कहाँ कहाँ से कुछ कुछ उठा के खिला देता है, वो खा लेता है, and now I'm suffering. My throat is also infected, and now after some time I will have stroke because of Naman. सर बहुत अच्छा खाना खा लीजिए. अरे खाएगा अच्छा, पेट खराब, गला खराब, ब्रेन खराब. That is called triglycerides. The LDL cholesterol destroys what? It creates stroke and it will destroy your brain. It destroys your brain. Now you are speaking, I love you. After that, you will say, what? People will say, I hate you. And we will say, I see you. Chhatrapal Vati Sahib is exactly waiting. How many people will have stroke right now so that we can admit you in ICU? Right? So I have told Dr. Vati that please book 5 beds of ICU right now so that after the class, maybe 1 or 2 patients may have stroke and we'll shift you to ICU. ICU means intensive care unit, and I will see you there.
सर सर।
क्यों गलत बोला आपने?
नहीं
रूम
नहीं,
बुक करके रखा है ना इन लोगों का,
बिल्कुल
बेड
बुक,
बुक किया है ना.
बिल्कुल खुलते ही बुक करना है बस।
हाँ बस, पता नहीं इनमें से किसी को स्ट्रोक हो जाएगा अभी.
वाह।
आप एडमिट कर दीजिएगा.
बिल्कुल सर।
मैंने रेफर कर दिया ऑलरेडी.
जी सर।
सुनील को तो स्ट्रोक होने वाला है, उसका साला साहब आ गया.
नहीं नहीं, ठीक।
So this is not required. Calcium overloaded and all these things are not required. But the main part you have to understand is where is the stroke, where is the region of the stroke, which artery is involved, which lobe is involved, what thing, please write the note, which artery is involved, which lobe is involved, which area is involved, and what kind of deficit you are facing. This is the primary. And when we speak about all these structures, we speak about what? Neurotransmitters. So when we don't have particular neurotransmitters like dopamine, we feel to all these things. That is why I say if you want to create a clinic, you must have a sufficient clinic to overcome these things. Even if you want to overcome pain, you have to have a sufficient infrastructure. If you don't have an infrastructure, how will you overcome pain? You only focus on the knee, but pain is not on the knee. Pain is contributed in the knee, but having structures elsewhere in the body. So be careful, understand that if you have one stroke, you have multiple problems. And these multiple problems can lead to multiple things. Not only spasticity, degeneration of the joint. You can be stroke, you have a frozen shoulder, bursitis, cervical radiculopathy, myelopathy, myelomalacia. You may have hip osteoarthritis, avascular necrosis, scoliosis, kyphosis, listhesis, retrolisthesis. Ayo, Brahma, you came with one, I gave you 25. Should not be your treatment. Dharma, I got your patient. I have received your complaint. He came with one, you gave him 25. Be careful. भाती साहब मालूम है धर्मा के पास एक पेशेंट गया था स्ट्रोक का उसने उसका स्कोलियोसिस भी कर दिया उसका काइपोसिस भी कर दिया एवास्कुलर नेक्रोसिस भी कर दिया हिप ऑस्टियोआर्थराइटिस भी कर दिया सर्वाइकल रेडिकुलोपैथी भी कर दिया और खाली खट खट बजा के इसलिए इसका नाम मैंने निकाला लगा धर्मा का खटखट राम खटाखट ये ना कौन बोलता ना आरजी बोलता ना खट 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 खट
खटाखट सर, राहुल
कौन बोलता है
राहुल गांधी सर।
क्या बोलता है खट 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 खट
टकाटक टकाटक सर।
खटाखट अच्छा खटाखट
खटाखट
बोलता है
खटाखट खटाखट, राइट सर,
हाँ
खटाखट खटाखट।
हाँ एकदम ठीक बोला है तुम लोग भी अपना न्यूरॉन्स को अगर इफ देयर इज अ स्ट्रोक you kill 1.85 million neurons every minute and in a chronic stage you kill every day 1 million neurons or 5 million neurons or 50 lakh neurons every day. So if you don't recover, you kill sufficient amount of neurons, and if you are not able to preserve it, what will happen? It will become the Sala of maybe Sunil, na? Sala of Sunil. He comes in his house and he will never go out of his house. So here you will see cellular injury during ischemia and cellular during ischemic changes. So you can see how much regeneration is in insufficient amount of oxygen and glucose, influx of water, loss of function and causes of accumulation of glutamate and aspirant with ADAMDA receptors, influx of calcium, inadequate energy supply, anaerobic metabolism, influx of water, and sodium and calcium. Now you see such a complicated thing has happened inside the brain. And it is all of a sudden. So it is called accident. So when you are having sudden events inside your brain, what do you call it? It's an accident. And that is why when there is a vascular, because the vessels are involved, it's called vascular accident. Now you see such a big damages happen. And how is your approach? हाथ को ऊपर करो हाथ को नीचे करो ऊपर करो नीचे करो दाएं करो बाएं करो आगे बढ़ो पीछे चलो do you recover paralysis like that मोती साहब ये नमन को बहुत अच्छा आता है न्यूरोथेरेपी ये
किसको सर?
इधर से उधर घुसा के एकदम पैरालिसिस को ठीक कर देता है ये
अरे
एक ही
क्या
बात
बात
बोलता
है।
है आगे
हाँ
करो पीछे
हाँ
चलो दाएं चलो और पैरालिसिस ठीक हो जाता है
जी सर, जी सर।
आप इसे सीख सकते हैं ये पैरालिसिस का गुरु है
हाँ
हाँ बिल्कुल एकदम इसका न्यूरोथेरेपी का तो कोई जोड़ ही नहीं है
कहाँ है
न्यूरो का
सर?
थेरेपी कर देता है
कहाँ पर है?
सर ये बांग्लादेश में रहता है
ऐसा क्या? वाह,
हाँ बांग्लादेशी है
बांग्लादेशी है। ठीक है।
हाँ बिल्कुल बांग्लादेशी है
हाँ, उनसे मैं बात कर लूंगा अलग से।
हाँ बिल्कुल हम लोग बांग्लादेश चलते हैं इसके बाद पढ़ने के लिए
बिल्कुल चलते हैं सर। अब कुछ दिन बाद अपन पूरा सारा वर्ल्ड टूर में निकलेंगे। पूरा पूरा वर्ल्ड
हाँ
को
बिल्कुल
पढ़ाएंगे। वर्ल्ड को पढ़ाएंगे कैसे ठीक करना है सबको।
बिल्कुल आई हैव ऑफर फ्रॉम जिम्बाब्वे मेरा पासपोर्ट नहीं है नहीं तो मैं जिम्बाब्वे का लेटर दे देता मेरा
अब
सबसे बड़ा
पासपोर्ट।
फायदा क्या मालूम है ऑल
हाँ
वर्ल्ड नोज आई एम सिक राइट
हाँ
सो
हाँ
व्हाट इज everyone knows Vati Saab is my doctor. So I
हाँ
can, I have, if I have to go, I have to go along with Mr. Vati. or any
Ah,
attender. So in any of my trip, those who
mm,
are good students, they can
ah,
accompany me free of cost. It is called FOC. What
okay.
it is called? Free
Yeah,
of cost. Ah,
थैंक यू सर अपन चलेंगे
because
पूरा इडली
people are
चपात सब
afraid
चलेंगे
of taking me alone.
मैं ले चलूंगा आपको मैं दवाई दूंगा आपको
अरे सर दवाई दो नहीं दो, आपको घूमना तो फ्री में मिल गया मेरी बीमारी के कारण.
क्या बात बोले हैं। लेकिन सर अपन नवंबर में ना रायपुर में
So
इतना
here you
टाइम
can see thermal formation of the role of platelets. So you can see how the platelet forms a thrombus, and you can see how this all damages happens. So what you see is only paradise is you have never seen the damages inside the brain. And this is my first focus to you, why you require number of pains, why you require number of things, because there is a huge thing which we have to recover. The recovery is very difficult. It is just like a bank loan. You have given a bank loan, and the customer will say, come tomorrow, day after tomorrow. नमन की तरह आज पैसे नहीं है, कल कल नहीं है, परसों फिर मिल बांट के कर लेंगे. अरे 2,500 रुपया में मिल बांटेगा तो अरे भाई नुकसान 2,500 का है बस, उसको 2,500 में खत्म करो. तुम लोग उसका ब्याज बना बना के you create compound interest, and for the loan which you have taken 2,500, you pay 5 lakh rupees for that. You damage such a way because you don't know what to do. The problem is inside the brain. I don't know what you are solving. You are reading an MRI, but you don't know what to do. You are reading something, but you don't know what is the approach. So you see, this is the edema formation. It's such a beautiful neural cells. If I take you inside the brain, you will really love the brain. I'll show you some of the beautiful structures and cellular communication inside the brain. You will really love it. The most beautiful thing what God has created is the human brain. You see, and then you have destroyed it, and then you can see there is edema formation inside the brain. So when there is edema, you can understand there is a CSF accumulation inside the brain. So whenever there is a CSF accumulation inside the brain, you can see there is a swelling inside the brain. And that is why I say when you encounter any patient or when you encounter anything, you must have sufficient thing to recover the patient. You should have enough knowledge. It is not paralysis, it is brain damage.
तो जरूरी है तुम
The
नंबर
only difference between your thought and my thought is very different. It is brain damage. For example, I told you I had 50 episodes of vomiting. I tried maximum antibiotics, but Mr. Chatrapal realized it is because of the stress I am taking. He referred me only one medicine, Desmet, and with anti-inflammatory drug. And you see, in one dose, I have recovered 90%. I'm speaking up to only one dose I took yesterday, and you see how much fine I have. And I have taken highest dose. I have spent 2 lakh rupees on antibiotic. How much? 2 lakhs. And the recovery has come from Desmet. So the correct diagnosis, the correct understanding, and correct approach is required. And that is why I always respect other citizens and everyone, because everyone has a different experience. Can you imagine one Desmet medicine can recover in one dose? And no vomiting for today. I'm speaking for to you. You see, when you speak over phone to me, so much. And now you see, there's nothing. So that is the approach you have to understand about the brain. The problem was from the brain. I'm treating the throat. You see, the biggest mistake I did. The problem was from the hypothalamus. Continuous deep thinking about different matters, how to bring Hamid Abbasi and all these things. What's the problem? Mr. Wati realized all this and he gave one what beautiful drug.
Yes.
And then you see, unnecessary, I took so many medicines. unnecessary side effects. So correct diagnosis and understanding about the disease is important. And that is what we are taught. So you can see clinical signs and symptoms. You can see various areas of the brain. These are called the Brodmann areas, which are dignified as geographical areas. And because of these geographical areas, wherever there is a problem, there is a deficit. So if it is 54 recovered, 2, 3, 4 is damaged, it is the hand, brain, leg functioning is damaged. Now, if you go for Diosum Pascal, they say about motor line, but when we speak about the neuroanatomy, there is nothing called motor line. There is nothing called two-third of motor line, two-third upper limb, two-third lower limb. The homunculus says every small muscle has its own importance in the brain, and it is commanded by that particular area. You imagine when you lose the command of that, you have to occupy the command of each muscle inside the brain. Naman, you are the this one, na? Can you bring Google here?
Yes, sir.
You can bring Google.
Uh, सर्च करना है सर, बताओ.
Onculus.
वेट सर.
Or motor cortex of the brain, homunculus of the brain. उसका पिक्चर दिखा.
अब ठीक है सर.
मेरे को तो नहीं दिखाई दिया, मेरे को तो एनाटोमी ऑफ स्ट्रोक ही दिखाई दे. एक काम करना, नेक्स्ट टाइम से तुमको स्लाइड दे देगा, तुम इन स्लाइड चलाते रहो जैसे वालिद करता था.
स्क्रीन शेयर करो नमन अपनी तुम.
स्क्रीन शेयर कर दिया मैंने.
नहीं आ रहा अभी.
होमुकुलस विजिबल है, स्क्रीन पर दिख रहा है.
मेरे को कुछ नहीं दिख रहा है.
विजिबल
आ
है,
गया.
विजिबल है. आ गया.
आ गया.
आ गया.
आ गया, दिख रहा है.
मेरे को
यस
नहीं
यस.
दिख रहा है, क्यों?
सर आपको अपना वो टैब चेंज करना पड़ेगा, थोड़ा सा आपको स्लाइड करना पड़ेगा. देखो उसमें होगा.
क्या चेप करे, किसको दबाए, कौन सा बटन दबाए?
स्क्रीन
यहाँ तो
शेयर
खाली
1 and
ओके
2 है ना.
बटन है बस.
There are two screen shares. You can see screen share 1 and 2. In that you can select screen share 2, sir.
वन पार्ट में तो यस. तो
हाँ,
इसमें
now I can see the image of this one.
अब आ रही है
Yes,
सर.
yes.
Yes, now you see everything you have lost, right? Fingers, wrist, elbow, all these are the commanding areas from the brain. You lost it, right? So now you have to regain it. You imagine such a big thing you have lost and you have to regain it. And how much game you are playing with paralysis. And you want to say, I practice this and I practice that. So how to go back to my slides?
आपके वाली स्लाइड में सर.
हाँ, मैं वापस अपनी स्लाइड में कैसे जाएगा?
सर आपको
शेयर.
दोबारा. यस सर, आपको शेयर स्लाइड करना पड़ेगा. मैं स्टॉप शेयरिंग कर रहा हूँ, आप अपनी स्लाइड शेयर कर दो.
ये क्या?
क्लिनिकल साइन एंड सिम्टम्स।
हाँ सर, आ गया।
Yes, sir. We can see.
ये तो आ गया, ये हिलता क्यों नहीं है अब? अच्छा, हिलता।
वो
I will
हो
take
रहा
some
सर।
time to learn, Baba, because I have not practiced all these things from years.
यस सर।
You can see I have touched laptop after 7 years. Or
बहुत
8 years, maybe 10 years. After I resigned from the mission director, this is the first time I'm operating laptop. You will love to know. I was moving my hand on the other side and I was thinking why the cursor is not moving. Then I realized, oh, I have to push my fingers here. Yes. So all if you teach me, I can also learn. So here you can see clinical signs and symptoms. You see the motor cortex area of the brain. Now when you damage all this, you have to resume this activity from the brain. The biggest problem is we don't know how to resume the activity from the brain. We see there is a loss from the brain, but we do not know how to resume it from the brain. And that is what I was saying for so long time. That if you don't have a proper infrastructure, if you don't have proper stimulation, proper mapping, proper guidance, how will you recover? Your recovery is zero. You started from zero, you are going to zero. Ananta Bhumi, Ananta Gatha. You see, so many morphologies has to happen inside the brain. Then stroke will recover. And what you all are doing. And who guided you? You see, now we cannot misguide you. So there are various slice, there are various frequencies inside the brain. So here if you see this type, it is called the coronal image. This is called the coronal image. This is called the sagittal and this is called the axial. So in axial images, you will see the midline shift and all. The coronal images, you will see various types of changes, degenerative changes inside the brain. So coronal, sagittal and axial, you will see various things inside the brain. The most important part is that in coronal is divide the head into front and back half. Front and back. You can see this is the front and
Back.
back. Right?
Yes, sir.
From left to right. Do you see?
Sagittal orientation.
Yes.
Yes.
Left
Sagittal,
and
what do you
right.
see? Left to right.
Right.
And when you see this axial is what?
Upper
Straight
and lower.
line. Straight line, right?
Dividing.
When you see straight line, it is what?
Upper and lower.
You see the ventricles. These are what? Ventricles. So if there is a dilation in the ventricles, CSF or anything, you see this is the importance of the MRI studies. You must know what you are looking, right? Coronal, sagittal, and axial. So you see, this is in acute ischemic stroke. So these are the image you can see in diffused weighted MRI ischemic stroke and perform 33 minutes after the symptoms onset. Generally, we take a CT scan, right? We take homework, we take CT scan because the images are very immediately we have images. But here you see, we found this image from a laboratory we have collected from Vijaya Diagnostic of a patient who had a stroke. And after 33 minutes of a stroke, we found out this image. And here you see, this is the image after 33 minutes of the stroke. Now you will see acute ischemic stroke is larger than diffuse hemorrhage. So here you can see the infarct. So you can see acute ischemic stroke. So this is again you see 1 hour onset of the stroke symptoms. Meantime, MTT map of the same patient. So after 1 hour, you see what are the changes. You see from 35 minutes to 1 hour, how much brain has been damaged. And now the patient has entered coma. If you see this image, the patient has gone into coma. Maybe the eyes are dilated and is by जग जीवन राम जग को विदा किया जग को बाय बाय जीवन का त्याग किया और राम से मिल गया तो उसको क्या बोलते हैं राम नाम सत्य है तेरी बोली गत्य है. Now you see here ischemia, infarct, and size location, and venous midline shift. You see how beautiful images are there, and you see the midline shift over here. So this was the place where IP Cherian played an important role. In 1805, Kocher and other people developed a trauma flap. So they cut this cranial bone, so the brain gets herniated. Herniated means brain बाहर निकल गया. So there is a midline shift. You can see here. Do you see a midline shift?
Yes, sir.
This is the midline shift. But if you do cystonostomy, you open the supracellular cistern. If you understand the principles of cooling and cleaning of the brain, and you open the supracellular cistern, what will you understand? The midline shift is overcome, the fluid diffuse edema of the brain is reduced, and patient is discharged from the hospital in 3 or 4 days. But if you do carinotomy, it takes months to recover, and if you do cystonostomy, you recover the patient in 3 to 4 days without deficit. And this is IP area. You see the images here. So you can understand the midline shift is very important part. If the infarct is increasing and if there is a midline shift, the Glasgow coma scale is decreasing, and the more it decreases, the more the danger of the life is there and the patient suffers. So here you can see whenever there is a stroke, we should go with first investigation is what? The color Doppler of the carotid artery. We go with the color Doppler of the carotid artery. One minute. Dr. Vilas was supposed to come. I don't know, he has come up. One minute, huh?
सर जी प्रणाम.
Just give me 1 minute, huh? I am on medical duty also. मैं ये एरोप्लेन मोड में रखा था तुम्हारे पास फोन आया है क्या ये व्हाट्सएप आपको इसका फोन आया है ये अभिलाष का अभिलाष अभिलाष नहीं आया ना, चलो ठीक है, वो भी आया। हाँ हाँ, बस वही चिंता था आपके साथ। ठीक है, हाँ ठीक है। हाँ बोलो बाबा। ठीक है बाबा, आप जाओ। ठीक है बाबा, जाओ। अच्छा, कोई बात नहीं, फोन नंबर किसी को देके जाओ। कोई प्रॉब्लम हो, नहीं कोई प्रॉब्लम हो तो आपको कौन उठाएगा? कोई इमरजेंसी हो तो आपको रात को कोई को बोलना पड़ेगा, बस टाई अप रखना बस। हाँ, सो मत जाना, दारू पी के सो मत जाना बाबा। जाओ, बट प्लीज बी इन टच। हाँ बेटा, sorry, I'm in hospital duty also. I'm teaching you from my room only. So if you see the carotid artery, this is the thrombus, right? So this thrombus is dislodged and enters the brain. So whenever there is a thrombosis and 80% stenosis in the carotid artery, you have to go for stenting. You have to remove this clot. Otherwise, you will have a ischemic stroke. So whenever there is a ischemic stroke, be careful, stenting has to be done. Am I clear?
Yes, sir.
कितना स्लाइड है इसके अंदर और? कितना स्लाइड है होगा? आज के लिए यही खत्म कर दे क्या, ये स्लाइड पढ़ा क्या? कल से मैं क्या करेगा, ये नमन को स्लाइड भेज देगा। नमन तुम स्लाइड चलाते रहो और मैं क्लास
क्या
लेगा।
कह रहे हो सर?
मैं स्लाइड दे देगा, इस क्लास स्लाइड को ले देता है, तुम लोग स्लाइड चलाओ, मैं क्लास ले लेगा, राइट?
अभी व्हाट्सएप पे?
व्हाट्सएप पे नहीं,
हम्म,
कल से जूम क्लास में।
ठीक है सर, आप स्लाइड शेयर करो।
क्योंकि मेरे को ये कंप्यूटर को समझने में टाइम लगेगा। So this generally, there are two types of angiogram: cerebral angiogram, angiogram, and DSA. The most important is the DSA. So whenever there is what you call aneurysm, we always advise digital subtraction angiography. So you go from here, pelvis area, and you enter the brain. You put a dye, and you can see the aneurysm inside the brain. You can have a full clear picture of the aneurysm. So here you can see the DSA image. So generally these are the images of the angiogram, and here you can see what? The aneurysms. So aneurysm is a bulging of the artery, right? So we finish it over here. My health is also not very good. I will take some, because I have a habit of teaching, standing and teaching. Sitting and teaching is not my habit.
Right.
If you allow me to stand and teach, I can teach you 25 hours. 24 plus 1, 25. If you make me sit, I will feel sleepy. But so you may ask me your questions, please. You can close the slides. So if I press OK, the slides are closed.
Yes, sir.
Yes, sir. Yes, sir.
There is a content of this meeting is being sent to third party. So if I press this, the slides are closed. How to close the slides? Ayo Baba, how to close the
स्टॉप
slides?
शेयरिंग कर दो सर।
Stop sharing, sir.
स्टॉप शेयरिंग, स्क्रीन शेयरिंग स्टॉप कर दो।
कहाँ से आता है ये? देखो, ये तो उल्टा सीधा। ये देखो ये सब आ रहे हैं, इसको ओके दबा देते हैं, स्टॉप शेयर कर देना,
Right, sir. Right.
स्टॉप शेयर करने से हो गया ना?
Yes.
हाँ कर दिया, गुड।
Yes.
Yes.
हाँ अब बताओ, व्हाट आर योर क्वेश्चंस?
So pranam sir ji.
हाँ बना जी, बताइए, आस्क योर क्वेश्चन।
Sir, I've studied all your notes, sir. आपने जो भी भेजा था last week में. Paralytic attack में guts are also affected, sir. It was said in one note, dysbiosis happens. Vagus nerve is affected.
Yes, you are right, beta. Vagus nerve is, see, there are two types of brain. First brain is your brain, and second brain is the gut, right? And the liver is one of the thing which affects it. Now, whenever you have a stroke, we put you on high antibiotic doses and everything. Generally, what we do, TP and all we give, right? So, because of these high doses, what happens? The gut get influenced, and also because of your fooding habits, eating this, that, non-routine. If you go with me, I'm definitely going to be the patient of dharam because my routine is very bad. So after some time, if I don't eat dharam, who will recover my paralysis? So my gut is also gone, my brain is also gone. But because of my willpower, I'm still okay.
Yes, sir.
So I
And
will
if
show
you,
you one small thing. I'll send one picture. Naman, I can send you one picture. Can you share it?
Yes, sir, sure. Yes, sir.
See, you have to cooperate with me. After some time, I will learn all these things because I don't know even how to operate the new one. What you call?
Yes, sir.
The
Just
digital board भी खरीद रहा, but हमको कुछ operate करना नहीं आ रहा. I will learn slowly everything. You have to teach me. Step by step, you have to teach me all that. And I assure you, I am a very fast learner. अरे मेरा कोमा वाला फोटो निकालो ना, तुम्हारे पास होगा फेसबुक से.
वेट, निकाल रहा हूँ सर, एक सेकंड प्लीज.
ये इंटरनेट ही काम नहीं करता.
व्हाट्सएप पे आया हुआ है. व्हाट्सएप पे भी है का फोटो.
ये रहा, मिल गया. ना मैंने एक फोटो भेजा, देखो. ये सी माय फोटो. हाँ गुड.
यस सर, यस सर, एक सर. डाउन
और उसके के साथ में दही मत.
ठीक है बाबा.
डन सर, शेयर आ गया सर.
Now you can see this is me in coma where my 70% of the brain is damaged. And I'm in ECMO, and with that transfusion, with 5 syringe pump. So this is the central line. I'm on ventilator. My Glasgow coma scale is 3. This is my 7th heart attack, and I'm waiting for the 8th one. And I'm sure the Haram will give me the 8th one heart attack.
sir, don't say.
No, never, sir.
You all will give me heart attack, only what you will give. The best gift you can give me is heart attack. So you see, even after having this stroke, I recovered and I'm sitting near you. And in less than 10 months, and after discharge from the ICU, third day I've joined my duty. कुछ बाबा जी और दही ले जाना, दही ले जाओ, दही ले जाओ, ये बर्बाद करना। इसमें दही दिया हुआ है क्या? इसमें दही डाला हुआ है क्या?
दही नहीं है, ये कल दोपहर में जो लाया था ना
हाँ
वैसा ही है, लेकिन इसका पराठा बना के लाया है।
ठीक है,
तेल कम, सब कम उसमें।
ठीक है।
तो दही मत खाओ उसके साथ,
नहीं दही तब नहीं खाएगा, मरना है क्या?
तो उसी के साथ मत खाओ।
अच्छा क्या बता दिया?
वरना
गला खराब है, अच्छा क्या बाबा जी?
प्रभु खाओगे ना,
नहीं और कुछ नहीं चाहिए बाबा जी, नहीं चाहिए
मीठा
बाबा
तो खाने का
जी। नहीं नहीं खा सकता।
घर से लड्डू लाए थे।
नहीं 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 खाना,
नहीं,
नहीं 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 खाना, नहीं
वो ड्राई फ्रूट की रोटी।
नहीं नहीं बाबा, और कुछ नहीं देना। अभी 2-3 दिन काम चलाना है।
अभी काम चालू है तो खा लो उसमें।
नहीं अभी क्लास ले रहा है, इंटरनेशनल क्लास ले रहा है। So what do you see by all this? You see the recovery of the patient. You understand this, and by this understanding, you understand one beautiful aspect of life. It's correlation of activities, correlation. And if you work wonderfully, you can recover this paralysis. But since you don't want to recover, what you can do? It's up to you what you want. You have seen so many things inside the brain. Now, after seeing so many things inside the brain, can you overcome GCS 2 or 3? Shivani, tell me how much chances are there when the saturation is 20 and GCS is 2 to recover? Eyes are dilated. Shivani, what are the chances of recovery?
How is this possible, sir? You have
Who
extra
is sitting
power.
near you? This
Yes, sir.
is, whose photo is this? A drama baj? Can you create this drama?
No, sir.
Huh?
No, sir. Not at all.
So it is not ventilator, it is not ECMO.
Sir, who said that? No drama at all. This is reality.
So beta, that is why I said there is no one to stop your career. There is no one to stop you. The only one who has stopped your career is your own thought. You see, I don't know anything, but I purchased this laptop. I'm purchasing this digital board. I'm converting my entire room into the classroom. I know nothing about it. I'm purchasing one podium, right? So that I can teach very nicely in the class. I don't know how to do it. But then it was the same thing which we did with the first city guided procedure. It's the same thing which we did with brain mapping. It's the first thing which we did, how to stimulate the brain with the pain. That is why I said lot of pains, lot of degrees, lot of variations are required. And I made it very easy. But I don't know why you all are finding it difficult and why you are thinking that patient will come, then we will buy, or this will happen. I'm just saying you one example. You must come out from your own mindset, mentality, and approach that you all can do very good things for the society. And you have to improve your approach. What is important is your approach. How do you approach a thing? You see, there was so much confusion about Dr. Hamid Abbasi. I intervened and I even spoke to the ambassador of Germany to bring Farah to India for NTCA. I arranged the tickets. And you know my bank balance is how much. But you see, I arranged everything so nicely. I purchased everything. After some time, you will see digital boards, everything you will see. Why? Because you should have interest. The moment you become interest, the mind is the biggest laboratory you have in the world. The way you think, the way you decide, you can become whatever you want. I wanted to defeat the brain in the way I wanted, and I'm able to do it. I am only the person who, a rare person in the world who's speaking. If you put a needle over here, you can deficit one particular muscle. Not, I can deficit one rectus femoris. by putting only one needle over here. I stimulate it and you will see the moment of rectus femoris is absent. That is the ability you have to obtain. That is the capacity you have to understand. And now you understood in a short run that there are so many types of strokes. There are 256 types of deficits. What you see is paralysis, but the cause is different. The morphology is different. The understanding is different. The pathophysiology is different. And what are you treating, you tell me? How can you recover people? हमने विचारों को बदली कर दो बस मिला मिलेगा इससे सबको आध्यात्मिक अवदान प्रभु ये तेरा पंथ महा ये मेरा तेरा नहीं है तुलसी धनी जी गए थे मिला मिलेगा इससे सबको आध्यात्मिक अवदान प्रभु ये तेरा पंथ महा आस्क क्वेश्चंस तेरा पंथ के बारे में मत पूछ लेना ज्यादा नहीं आता ब्रेन स्ट्रोक के बारे में पूछेगा तो बता देगा आस्क क्वेश्चन भाई थोड़ा तो इज्जत करो इतना पढ़ा है कुछ तो पूछो एक सवाल मेरा इज्जत के लिए तो पूछ लो नहीं तो लोग क्या सोचेगा शिवानी तुम कहीं से सवाल ढूंढ के पूछ लो चैट जीपीटी से पूछ लो क्या सवाल पूछना है व्हाट क्वेश्चन शुड आई आस्क टू मिस्टर एम के शास्त्री इतना बोलने से भी वो बता देगा चैट जीपीटी को भी मालूम है एम के शास्त्री कौन है इन ब्रेन स्ट्रोक सो I only have to say that you have lost certain abilities in homunculus of the brain, right? Motor cortex. The ultimate thing in pain management or anything is to revive that ability to recover. The revival is important. The moment you revive, the moment you go ahead, you can do things very nicely. So all is up to you. Whatever you want, whatever you think, you can achieve. The achievement is always there. Woods are lovely, dark and deep, and yet the promise is to be kept. And miles to go before I sleep, and miles to go before I sleep. These classes will continue forever. I am thankful to Dr. Naman who has sponsored these classes. I request all of you that please don't make a burden on Mr. Naman. Just the class should be continued. So make one or two more admin and all of you can contribute some amount of money, 1,000 or 500 or 700 rupees. So that, and please advertise in the groups, various groups, right? So that more and more people can be benefited. We are here not to make money from you, right? We are here to tell you this is the real medical science. And you have to understand it because you are dealing with the patient every day. If you deal them correctly, no problem will come. There is nothing called complication. We only create complications, right? So from tomorrow, place it the advertisement in such a way that people can understand the classes are going on and fellowship classes are going on. Place in different groups. Associate with different people. You are in so many WhatsApp groups. Make your own advertisements and make a communication in such a way. Because if you don't know how to communicate, how will you be able to know? If I don't know how to teach you, how will you understand? Am I right or wrong? See, practicing is different and teaching is different. For example, very simple, I said, party ki party, Sastry ki lathi. So you can understand RTCM and NTCM. So you all enjoy your life. God bless you, my children. Thank you. But my only humble appeal is let us come to 300. Put your efforts. Coming, not coming is not the problem. Let us join people because सबसे बड़ा ज्ञान है ज्ञान दान। क्षमा दान से ऊपर क्या है? ज्ञान का दान। क्योंकि ये ज्ञान का दान होने से हजारों लोगों का जीवन का मुक्ति मिलेगा, एंड यू विल गेट लॉट ऑफ गुड मेरिट्स इन योर लाइफ। इसको मैं बोलता धर्म का काम ही है, एंड यू हैव टू स्पेंड नथिंग। इसी को हमारे सिख प्रथा में बोलते हैं क्या? भंडारा। तो ज्ञान होने से बहुत कुछ अच्छा हो सकता है। हैव गुड नॉलेज, support the society with God knowledge, and encourage things, right? Don't discourage, encourage. I always say encourage and remove wrong people from the group. We don't want wrong people who have politics in their mind, but we want right people so that we can grow together. Ultimately, what is required is equipping yourself with good knowledge. So that when a neurosurgeon speaks something, you are able to understand what he is speaking. You can understand this circle of Willis. This is what ischemia is. The MRI images are there. Ultimately, my work is what? To get you integrated with 100 neurosurgeons. So that part is you have to understand. I thank you, all of you, for all your cooperation. But only humble request to
थैंक यू
all of
सर।
you. Only humble request to all of you. See, the family has to grow. Vasudeva Kutumbakam. Let the family grow. Let the knowledge. When you see a sick person like me can take such initiative with all my efforts to teach you all, why don't you try to take small efforts to spread this knowledge? We are not asking money. Am I asking money?
No, sir.
Am I asking anything?
No, no,
No,
sir.
no.
I'm only asking, please study and do right things in your clinic.
Okay, sir.
You will also earn money and society will be supported by you. एक भला सो भला, नानक नाम चढ़ती कला, तेरी वाणी सर्वत्र भला। सबका भला हो। जो नानक का नाम बोलते हैं ना, जो नानक की वाणी समझ ले, नानक नाम चढ़ती कला, यानी नानक का जो नाम है वो सारी कलाओं से ऊपर है, और उसकी वाणी को समझ ले तो तेरी वाणी सर्वत्र भला हो। उसकी वाणी जो समझ लिया, नानक की वाणी, उसका सबका भला हो। तो वाहे गुरु जी आपकी सबकी मदद करे, बाबा जी मेहर करे आप लोगों पर। Try to improve more people, join more people, support people, don't discourage, encourage. But as a result, we should not encourage wrong things to happen also. Please don't put overload on me. My health is not very good, as you all know. But even then, I'm trying my level best to do everything. I have a Bangalore workshop. I was supposed to be admitted in ICU yesterday, but today I have to take class, so I denied Karthik, and I have gone with my own treatment. Bhatiji helped me. So, in spite of all drawbacks, we have to overcome this drawback, and we have to say, we have to defeat and eradicate paralysis from society, because it is not about one person, it is about the whole family, it is about the whole society, it is about the economic deficiency of this society. एक आदमी को पैरालिसिस हो जाने से देखो कितना बड़ा एसेट का नुकसान हो गया। फॉर एग्जाम्पल, इफ यू सी the chairman of ISRO become paralyzed, we lose such a big asset of this country. If APJ Abdul Kalam became paralyzed, we lose such a big asset of the country, right? So we should understand it is not about one person, or it is not about you or me. It is about the whole society, which we have to take the responsibility. And what we have to do is only typing and deleting. That's all. We have only two things. What? Typing and deleting. And my humble request to all of you, please increase the number of people in Gurgaon, right? so that we can invite neurosurgeons in your talks. Until we have 40